All right. Let's hope I'm not COVID sick while I'm recording this. Although that would be apt. So the next thing we'll talk about is bioethics. You might have heard of the Hippocratic Oath, right? First, do no harm is the short version, even though it's not actually in any of the Hippocratic Oaths I've ever heard. But there's been historically in the medical profession some ideas of how doctors ought to behave. These were expressed at multiple points in history. And in recent history, there's been multiple instances of doctors saying just what they hold to be their professional standards. Right? Um, there was a moment in World War II where it turned out that doctors were behaving in horrific ways. And this was a moment that shocked everybody. It made the medical community decide that they needed to codify some of their shared values, some into some real form that could be tangibly pointed to in textbooks and by different doctors, right? So I'm not going to describe any of the horrific Nazi atrocities. There's plenty of places on the internet you can find about what they did to Jewish, disabled Roma, and twin populations, along with professors, journalists, and communists. But I'll tell you, you definitely did not want to be a twin. Twins got singled out as medical subjects, and they did pretty horrific things that I wish I had never heard about. So many of the doctors that were tried were sentenced to death, or sentenced to life imprisonment. And a lot of them felt no shame about what they did. And so after the Nuremberg trials, there became a code, a Nuremberg code, like a Bill of Rights or a 10 Commandments, a list of 10 agreements that medical professionals were required, or well, supposed to have been required to agree to. Voluntary informed consent, positive results for society, based on like good science to justify an experiment, avoiding unnecessary harm and suffering, should not be conducted if it can cause harm or death or disabling injury to somebody. The risks should be proportionate to benefits. The subjects must be protected. The staff must be trained and qualified. Human subjects must be able to quit at any point, and medical staff must stop if continuation would be dangerous. These were agreed upon. And in fact, after World War II, there was a lot of study in psychology about how any of this could happen. And it turns out it's actually pretty easy to get people to violate other people's autonomy and rights. We don't need that much of a push. We just need to be in the right circumstances. But that was a Nuremberg Code. At later points, oh yeah, I should point out that this was seen as applying to healthy volunteers, not patients. There were later codes. The Belmont Report, I'll talk about in the next section about why it came about. But the Belmont Report argued, instead of for a top 10, it was a top 3. Autonomy, justice, and non-maleficence. Later on, they added beneficence. The basic idea is treat your patients as if they have wills of their own and minds of their own that are worth being protected. Be fair and consistent. Do good, don't do harm. Trying to summarize the 10 things before into top 3. It doesn't include trained staff here, but presumably that has something to do with beneficence. It's hard to do good if you're not trained. But, sorry, the non-maleficence was added later, my bad. But one of the things here is that all of these have been debated back and forth. There's been issues with these. And in fact, they weren't actually codified until a couple of years later. Institutions all around the country and the world began instituting review boards for which all human experimentation had to go through. The idea being that other people that weren't a part of the studies would be able to better judge whether something would be good or bad. Okay. So I've given a lot of history of how medical community came to be what it is, how medicine came to be how it is. And we're going to be spending a lot of his time talking about history today. In fact, it's all going to be history. And really, there's a bunch of reasons to think about this. I think that it's really hard to understand what's going on now or what's going to happen in the future unless you can grapple with the past. I think really smart people have existed for a really long time, and a lot of the problems that we face now, people have faced before, and in fact, we might be facing those problems because of how they responded to them before. So that's the setup. Let me knock it down. I'm going to talk about 2 separate cases taking place concurrently. One relatively quickly. I'll tell the story of Henrietta Lacks, who had 5 children as a child and in her 20s, and then was diagnosed with cervical cancer and died. The treatment at the time, so she went into Johns Hopkins University and received free treatment because she was of low income, and it was the hospital that treated Black people. As with every other patient, they took cells from her, and I think what happened with those cells ends up becoming the reason her story is important. Otherwise, she would be one of the many people that died. The treatment for cancer at this point was to try to radiate it away. It didn't work. She died a couple of months after being diagnosed. So her cells were eventually called the HeLa strain of cells. It turned out that doctors had been attempting to grow human cells outside the human body in a lab for literal decades. There had been a thought that they had accomplished this in the 19-teens, but it turned out to be, I guess, a mistake. The doctor was contaminating his sample again and again with new cells. So doctors had been trying to grow cells past 40 generations. It was really hard to do this, and it was important to do this because you couldn't keep just harvesting new cells. You wanted to be able to do something to the cells outside the human body to see how they would respond. And if they just died within a couple of divisions, you wouldn't be able to get much work done. So her cells were immortal. They did not die out. Her cells were used for literally every single medical advance in the past 70 years. And I think the horrific part about this, which you'll see if you read the book about her, The Immortal Life of Henrietta Lacks, or watch the movie, or read up on it, was not that they took cells without her consent. It's not even that those cells became a billion-dollar industry, because the doctor that took the cells didn't actually make as much money as he could have. It's that they kept going back to the family later to get samples from them, and they didn't tell them what had happened with her mother's cells, their mother's cells, for decades. So this is, after the Nuremberg Code, after the Belmont Report. Her family did not find out what her mother's cells had been used for. And in fact, they've been used for all sorts of things. They've gone to the moon and back. They're in most labs. Well, not most labs. They're in many labs. They thousands of papers have been published from them, hundreds every month. But her family was never viewed as somebody to which people could explain this science to. They were never told about it, and they continue to be exploited. In fact, even in 2013, the HeLa genome was published, and nobody bothered to tell the family that their medical information was being exposed. So that's HeLa. Now let's talk about syphilis. Syphilis, this seems like a hard pivot, but if you know what I'm about to talk about, it's not that hard of a pivot at all. Syphilis was a disease that spread around the world very quickly in the 15 and 1600s. It was present early on in American history. Soldiers during the Revolutionary War were fined if they had any venereal diseases that kept them from being in battle. There were huge problems with it for a long time, and the treatments for it were pretty mediocre. Syphilis is this disease. It's a sexually transmitted disease, which causes genital sores and ulcers and pain. The problem is that goes away. And it's not until later, quite a bit later sometimes, that a secondary stage comes about, which is a rash, sore throat, fever, all sorts of things. And people just get a grab bag of these. So a lot of people get syphilis, treat it with whatever they think works, and then later on they have another disease that they think is just something else, but in fact it was syphilis in their body. And then they get crazy and waste away. Early treatments, including just electrocution, mercury, rubbing the sores with holy wood. It's not until, so I put a green line there to divide the ones that are nonsense from the ones that actually work. It turns out inducing malaria can actually kill the bacterium that causes syphilis. So a high enough fever could actually help. In the 1930s, we discover penicillin, and then by the 1940s, we discover that it can be useful for treating syphilis and all sorts of other things. That date's going to be important because I said that syphilis was an issue for soldiers all around the world for most wars, or at least the past couple of hundred years worth of wars. After World War One and after World War II, there was a renewed interest in healthcare. Soldiers coming back tended to have issues, especially after World War One. That's where the rise in medical treatments, or psychological treatments comes about. You get the very first cases of PTSD being documented. But also STIs become an issue. People really want to figure out how to deal with some of these sexually transmitted diseases. In the 1940s, the United States, in conjunction with the government of Canada, of Guatemala, found a prison population where they were able to recruit prisoners, some of them by force, and they purposefully infected them with syphilis, and half received treatment and half didn't. The idea was to see if penicillin was going to be useful for prevention and treatment of syphilis. If the prisoners refused to have sex with a syphilis positive prostitute that the U.S. National Institute of Health hired in Guatemala, they would just swab their urethras with the culture from the sores. The study ended early, and we basically just abandoned those prisoners. But the people that were working in that study found another job in another study that had been going on in Macon County, Alabama, since 1932. I think the initial purpose of it was to observe the progress of syphilis for a year and then treat it. But then funding ran out, and nobody did anything for a while. And then people began realizing that they could abuse this population for medical purposes. So to set it up, there were 600 poor African-American men in rural Alabama, and the African-American and the Alabama is all relevant, right? These were people with very little or no political clout whatsoever, unable to find help. They were recruited with the promise of free healthcare and burial costs. But then they weren't told about their disease, and they weren't treated, and they were prevented from being treated. And in fact, in World War II, a lot of these men went to try to volunteer to enlist, and the doctors purposefully contacted the draft board, the war board, to prevent them from telling these men why they were being refused, to prevent them from becoming aware that they were positive with syphilis. There are many confirmed cases of them infecting their wives and other people and causing this community. And they received, quote, healthcare, but no treatment for their primary ailments. Decades later, there were 3 separate people who tried to blow the whistle. One released a press release, another person issued up a warning through the proper channels, And one person spent several years trying to get the attention of the media before one of his friends, Gene Heller, who had actually heard him complain about this before, finally listened one day and published a study, an article on this, revealing that the United States government had been withholding treatment from Black men for decades. That's what led to the Belmont Report being commissioned. The White House eventually apologized for this to the surviving members, but not for several more decades after it was revealed. COVID-19 has horrific consequences for Black Americans and for Latinos in the United States. There is a very specific relationship between African Americans and medicine in the United States. And it has to do with some of these stories that I've just told, along with others. There's the important thing to realize is that all of the people that were involved running these studies were all aware of these codes of ethics. And yet they continued anyway because they didn't see their patients as worthy, in some sense, of being, treated better. Oh yeah, I didn't mention the Holmesburg prison experiments, just which went on after this as well. And there's been several other examples I could keep mentioning. These horrific ways of treating prisoners, poor people, at-risk populations, minority populations, has just continued in this country and all over the world, to be fair. Something to keep in mind. In the next video, I'll wrap this up with a discussion of drugs.